Today, we are going to talk about a community service called ACT Team in short form, but Assertive Community Treatment. Over the years, the model of care has come to where patient care is taken in mostly in the community rather than in the hospitals. And there is a subset of population who, with a diagnosis of schizophrenia or schizoaffective disorder, they need care to be delivered where they are. Either they're homeless or they're um, uh, their apartment or wherever they are, the care is delivered there. And ACT is that model where you have the psychiatrist, you have the social worker, you have um, peer review staff, peer staffers, they all together come to deliver the care at where the patient is. So let's look at it. It's a comprehensive mental health care model, and it's a team-based model. They're available for 24/7 crisis support and continuous care system. And the core services involve, they do psychiatric assessment, they do medication management, they do individual therapy. If there is crisis, they resolve that and treatment planning. But everything happens, delivery happens at the client's location. Okay, sometimes it's under the bridge if the patient is homeless. So they're like, for homeless population, they do housing assistant, there is employment support, there is life skills training, there is benefit management, and there is family education. And then there is community integration where there you are giving them how to navigate the resources in the community, helping them with social networking. Sometimes they can come and attend community activities, peer support, and social skills development. Now, what is the benefit of this program? There is significant reduction in hospitalizations and 74% reduction in crisis visits. ER utilization is reduced, symptoms are reduced, and admissions are reduced. So the goal is to keep the patient out of the hospital and keep them more functional. There is increase in housing, quality of life improves, employment rate. Some people work in post office or a job which is not that intense. They're part of the community and their family relationships are improved. So you see there is significant reduction in ER visit and quality of life improves. Now, when you look at implementation standards, the team structure is there is 1 to 10 staff to client ratio. There are multidiscipline teams. There is a caseload which is shared, 24/7 service coverage, community-based care, flexible service hours, and evidence-based practices, outcome monitoring, and continuous improvement. So this is the key learning points is the focus is on real world skill development and autonomy of the patient and support in their own settings and reduced emergency service utilization. And it's an integrated service delivery model. So I hope that this helps. There may be a few questions asked on this about the ACT team and how this model works. Thank you very much.